The emergency department at St. Helena Medical Center buzzed with its usual controlled chaos as the night shift took over. Nurses hurried between rooms, residents reviewed patient charts, and the steady beep of monitors created a familiar symphony of healing. The fluorescent lights cast their harsh glow over polished floors where countless lives had been saved, lost, and forever changed. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed because tomorrow I've saved something extra special for you. Dr. Sarah Chen finished updating a trauma patient's chart when the head nurse, Margaret Torres, approached her station. Dr. Chen, we have a new addition to the team starting tonight, contract medic from the agency. Sarah looked up from her paperwork. Another temp? That's the third one this month. Budget cuts, Margaret shrugged. Administration says it's more cost-effective than hiring full-time staff. She should be here any minute. The automatic doors slid open with a soft whoosh, and a woman in her early 30s entered the emergency department. She wore standard medical scrubs with no hospital identification, carrying only a small personal bag and a tablet. Nothing about her appearance commanded immediate attention. No prestigious university pins, no specialty certifications displayed, no designer stethoscope that marked the ambitious residence. She moved with quiet purpose toward the nurse's station. "Excuse me," she said to Margaret, her voice calm and professional. "I'm Alex Thompson. I'm here for the night shift assignment." Margaret consulted her clipboard. "Thompson, yes, contract medic, right? We weren't given much background information. Just that you have the necessary certifications." Alex nodded simply. "I do." Dr. Chen observed the exchange from her workstation. Contract medics were typically recent graduates looking for experience or older professionals who couldn't maintain steady employment. This woman seemed too composed for the former and too young for the latter. There was something in her bearing that suggested familiarity with high-pressure environments, though she wore no insignia to indicate any specialized training. "Well," Margaret continued, "Dr. Chen will be your supervising physician tonight. She'll show you the ropes and assign your duties." As Alex approached, Sarah extended her hand. "Dr. Sarah Chen, Emergency Medicine, welcome to St. Helena." "Alex Thompson, thank you for having me." The handshake was firm, confident. Sarah noticed calluses that seemed inconsistent with typical medical work. And Alex's eyes had a quality of constant assessment, as if cataloging exits, equipment locations, and potential threats. It was subtle, but Sarah had seen it before in military personnel who'd transitioned to civilian medicine. "So Alex, what brings you to contract work?" "Most medics prefer the stability of permanent positions." Alex's response was measured. "I prefer the flexibility. Different facilities, different challenges, different opportunities to help people." It was a non-answer that revealed nothing while sounding perfectly reasonable. Sarah decided to press gently. "Where did you do your training?" "Various places. I've worked in several different environments." Another deflection. Sarah's curiosity was piqued, but the emergency department was no place for extended conversations. "Well, let's get you oriented. Tonight's been relatively quiet, but that can change quickly." Dr. James Morrison, a senior resident, approached as they walked toward the trauma bays. "Sarah, who's the new face?" "Alex Thompson, contract medic. Alex, this is Dr. Morrison." Morrison barely glanced at Alex before turning back to Sarah. "Contract medic? Great, another temp who'll need constant supervision. As if we don't have enough problems with staffing." Alex said nothing, but Sarah noticed a slight tightening around her eyes. Morrison's dismissive attitude was unfortunately common among some of the permanent staff toward temporary workers. "Dr. Morrison," Sarah said firmly, "I'm sure Alex will be a valuable addition to our team." Sure, Morrison waved dismissively. "Just keep her on the simple stuff. Vitals, basic wound care, maybe some sutures if she's lucky. We can't afford mistakes from someone who'll be gone next week." As Morrison walked away, Sarah turned to Alex apologetically. "I'm sorry about that. Some of the residents can be territorial." "It's fine," Alex replied quietly. "I'm used to it." The orientation continued, with Sarah showing Alex the layout of the emergency department. As they moved through the trauma bays, supply rooms, and equipment storage areas, Sarah noticed Alex's remarkable attention to detail. She seemed to memorize the location of every piece of equipment, every medication cabinet, every emergency protocol posted on the walls. "You seem very familiar with hospital layouts," Sarah observed. "I've worked in a lot of different facilities," Alex said simply. They paused at Trauma Bay 3, where a patient was being treated for a minor motorcycle accident. The attending physician, Dr. Kevin Walsh, was explaining the procedure to a nursing student. "The key with road rash," Dr. Walsh was saying, "is thorough cleaning to prevent infection. You have to be aggressive with the debris removal, even if the patient complains." Alex watched silently as Dr. Walsh demonstrated the cleaning technique. After a moment, she spoke quietly to Sarah. "The irrigation pressure seems low, and he's missing some embedded particles in the deeper abrasions." Sarah looked more closely at the patient's wounds. Alex was right. There were several small pieces of gravel that Dr. Walsh had missed, and the saline irrigation wasn't providing adequate pressure for proper cleaning. "Should we say something?" Sarah asked quietly. Alex shook her head. "Not my place. I'm just observing." But Sarah had noticed something in Alex's assessment that went beyond basic medical knowledge. Her evaluation of the wound care was precise, experienced, and suggested familiarity with trauma treatment beyond what most medics encountered in civilian settings. The night progressed with routine cases: a child with a fever, an elderly man with chest pains that turned out to be heartburn, a college student who'd had too much to drink. Alex handled each assignment with quiet competence, following instructions precisely and never overstepping her designated role. During a brief lull around midnight, Nurse Torres approached Sarah. "How's the new medic working out?" "Better than expected," Sarah admitted. "She's very skilled, but there's something. I can't put my finger on it. She seems overqualified for contract work." "Maybe she's one of those people who can't handle the politics of permanent positions," Torres suggested. "Some folks just want to do the work without the drama." Sarah nodded, but her instincts told her there was more to Alex Thompson's story. The way she moved through the emergency department, her immediate familiarity with equipment placement, her uncanny ability to assess situations quickly, it all suggested experience beyond typical civilian medical training. Dr. Morrison reappeared, clipboard in hand. "How's our temp doing? Any disasters yet?" "She's doing fine, James. Actually, she's quite competent." Morrison glanced over at Alex, who was taking vitals on a patient in Bay 4. "Competent maybe, but I still don't trust temps with anything serious. Give them a heart attack or a major trauma, and they freeze up every time." As if summoned by his words, the ambulance bay doors burst open. Paramedic teams rushed in with 2 gurneys, their radios crackling with urgent communications. "Trauma 1 incoming," the lead paramedic called out. "Multi-vehicle accident, 2 critical, ETA 30 seconds." The emergency department transformed instantly. The casual atmosphere evaporated as staff moved with practiced efficiency to prepare for the incoming casualties. Sarah felt the familiar surge of adrenaline that came with major trauma cases. "Alex," she called out, "assist in trauma by 2. Basic support only." Alex nodded and moved toward the designated area, but Sarah noticed something different in her posture. Gone was the quiet, almost deferential bearing she'd maintained all evening. Her movements became more decisive, more purposeful, as if responding to some internal switch being activated. The first ambulance arrived with a woman in her 40s, conscious but showing signs of internal bleeding. The second brought a teenage boy with multiple injuries and compromised breathing. The emergency department erupted into controlled chaos as 2 trauma teams formed around the patients. Dr. Walsh took the lead on the woman's case, barking orders as monitors were connected and IV lines established. "Get me 2 units of O-negative stat. I need a chest X-ray and a full trauma panel." In Trauma Bay 2, Dr. Morrison was working on the teenage patient. "This kid's in bad shape. Possible pneumothorax. Definitely some internal bleeding. Where's the respiratory?" "On their way," Nurse Torres called back. Alex stood at the periphery of the trauma bay, officially there to assist but clearly relegated to observer status. Sarah watched as she assessed the scene with those same calculating eyes, taking in details that others might miss. The teenage patient's condition began to deteriorate rapidly, his blood pressure dropped, and his oxygen saturation levels fell despite supplemental oxygen. Dr. Morrison's confidence wavered as he struggled to identify the source of the respiratory distress. "His pressure is dropping fast," the monitoring nurse called out. BP 60/40 and falling. Morrison ordered more fluids and increased the oxygen flow, but the patient's condition continued to worsen. Sarah could see the panic beginning to set in among the less experienced staff members. Preparing and narrating the story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. It was then that Alex stepped forward, her voice calm but carrying newfound authority. "Dr. Morrison, I think you need to consider tension pneumothorax." His trachea is deviated, and listen to the breath sounds on the left side. Morrison paused, stethoscope halfway to the patient's chest. "I'm sorry, who asked for your opinion?" "The patient's going to code if you don't decompress that chest," Alex said simply, her tone respectful but urgent. Sarah moved closer, watching the dynamic shift in the room. Alex was no longer the quiet contract medic following orders. Something had changed, as if the critical situation had triggered a different version of herself entirely. Morrison listened to the patient's chest, his expression growing concerned as he confirmed Alex's assessment. The breath sounds on the left side were indeed diminished, and the tracheal deviation was becoming more pronounced. "Nurse, I need a needle decompression kit," Morrison called out, his earlier dismissiveness replaced by focused action. As Morrison prepared for the emergency procedure, Alex quietly positioned herself near the patient's head, monitoring his airway and vital signs with an intensity that seemed beyond her supposed role. Her hands moved with practiced precision, adjusting equipment and anticipating needs before they were voiced. The needle decompression was successful, and the patient's condition stabilized. Color returned to his face, his blood pressure improved, and his oxygen saturation climbed back to acceptable levels. The immediate crisis had passed, but Sarah noticed that Alex remained vigilant, continuing to monitor the patient with the kind of focused attention typically reserved for the most experienced trauma specialists. Dr. Morrison straightened up, wiping sweat from his forehead. He looked at Alex with a mixture of surprise and grudging respect. "Good catch," he said quietly. "Where did you learn to recognize tension pneumothorax so quickly?" Alex's professional mask slipped back into place. "Experience," she said simply, then moved back to her assigned position at the periphery of the trauma bay. But Sarah had seen something in that brief moment of crisis. The way Alex had assessed the situation, the confidence in her voice when she'd identified the problem, the practiced ease with which she'd positioned herself to assist, it all pointed to experience far beyond what any typical medic would possess. As the trauma cases were stabilized and transferred to appropriate units, the emergency department began to return to its normal rhythm. But Sarah couldn't shake the feeling that she'd witnessed something significant. Alex Thompson was clearly more than just a contract medic looking for temporary work. During the post-trauma debriefing, Dr. Walsh approached Sarah. "Your new medic made quite an impression tonight. That was a textbook diagnosis of tension pneumothorax. Most residents would have missed it." "I noticed," Sarah replied, glancing over at Alex, who was quietly restocking supplies in the trauma bay. "She seems to have more experience than her paperwork suggests." "Maybe she's a former military," Walsh suggested. "Combat medics sometimes have trouble transitioning to civilian medicine. Too much bureaucracy, not enough action." It was a plausible explanation, but Sarah sensed there was more to the story. As the night wore on, she found herself observing Alex more closely, noting the small details that suggested a background far more complex than simple military medical training. The way Alex moved through the emergency department wasn't just confident, it was tactical. She seemed to maintain constant awareness of her surroundings, positioning herself to have clear sightlines and quick access to critical equipment. When handling medical instruments, her movement showed a precision that spoke of extensive training under high-stress conditions. Most telling was her interaction with the trauma cases. While she maintained the deferential posture expected of a contract medic, Sarah had caught glimpses of something else, a depth of knowledge and experience that suggested she was deliberately holding back, concealing capabilities that went far beyond her official role. As dawn approached and the night shift prepared to hand over to the day team, Sarah found herself more curious than ever about Alex Thompson. Who was this woman who could diagnose critical conditions with a glance, who moved through a hospital like someone accustomed to life-and-death decisions, yet presented herself as nothing more than a temporary worker? The mystery would have to wait. The day shift was arriving, and Alex was gathering her belongings, preparing to leave as quietly as she had arrived. But Sarah had made a decision. She was going to find out who Alex Thompson really was, and why someone with her obvious skills was working as a contract medic in a civilian hospital. Something told her that St. Helena Medical Center had just gained more than a temporary staff member. They had gained someone whose true capabilities were yet to be revealed, someone who might prove invaluable when the next crisis arrived. And in a place where emergencies were a daily reality, Sarah had a feeling they would find out sooner rather than later exactly who Alex Thompson really was. Dr. Sarah Chen arrived at St. Helena Medical Center the following evening with more questions than answers. She'd spent the day researching Alex Thompson through every medical database she could access, and the results had been frustratingly sparse. No medical school records at major universities. No residency programs, no published papers or conference presentations. For someone with Alex's apparent skill level, her professional footprint was virtually non-existent. The charge nurse, Linda Vasquez, was updating the patient board when Sarah approached. "Linda, do you have the personnel file for our new contract medic, Alex Thompson? The temp from last night?" "Sure, but there's not much in it." Linda pulled out a thin folder. "Just basic certification verification and emergency contact information. The agency doesn't usually provide detailed backgrounds on short-term contracts." Sarah flipped through the minimal paperwork. Alex's certifications were current and legitimate, but they were all recent, issued within the past 2 years. No employment history, no references from previous positions, no indication of where she'd gained the extensive trauma experience she'd demonstrated. "Strange," Sarah murmured. "It's like she didn't exist professionally 2 years ago." "Maybe she took time off for family reasons," Linda suggested. "Or worked overseas somewhere that doesn't show up in our databases." Before Sarah could respond, the familiar automatic doors announced Alex's arrival for her second shift. She entered with the same quiet confidence as the night before, wearing identical scrubs and carrying the same minimal personal items. But now Sarah was watching with trained eyes, looking for details she'd missed during their first encounter. Alex's gait was different from typical medical personnel. There was a measured precision to her steps, a habit of pausing briefly at doorways to assess rooms before entering. Her eyes constantly moved, cataloging people and equipment with the kind of situational awareness Sarah had seen in security professionals and military personnel. "Good evening, Dr. Chen," Alex said as she approached the nurse's station. "What's the caseload tonight?" "Fairly typical for a Tuesday," Sarah replied, studying Alex's face for any reaction to her scrutiny. "Though we did have an interesting case come in this afternoon. Hiking accident up in the mountains. Multiple trauma. Complicated extraction." Alex nodded politely, but Sarah caught a flicker of something. Interest, perhaps, or recognition. How did the extraction team handle the terrain challenges? It was an odd question for a hospital-based medic to ask. Most civilian medical personnel wouldn't think about extraction logistics unless they'd worked in wilderness medicine or emergency response. "Do you have experience with difficult extractions?" "Some," Alex replied, then quickly shifted the subject. "Where would you like me to start tonight?" Dr. Morrison appeared before Sarah could probe further. His attitude toward Alex had notably improved since the previous night's trauma case, though he still maintained a condescending edge. "Thompson, right? You did good work last night with that pneumothorax. Maybe you're not as green as most temps," he consulted his tablet. "We've got a cardiac patient in Bay 6 who needs monitoring, and there's a possible stroke in Bay 2 waiting for the neurologist." Alex accepted the assignments without comment, but Sarah noticed her immediate movement toward Bay 2 rather than the cardiac case. Stroke patients required more complex assessment and carried higher risk. Most contract medics would choose the safer cardiac monitoring assignment first. Sarah followed Alex into Bay 2, where they found Margaret Torres, the head nurse, taking vital signs on an elderly man who appeared confused and agitated. His speech was slurred, and his left arm showed obvious weakness. "Mr. Patterson came in about an hour ago," Margaret explained. "His wife says the symptoms started suddenly while they were having dinner. Classic stroke presentation, but the neurologist is stuck in surgery." Alex approached the patient's bedside, her demeanor shifting into the focused assessment mode Sarah had witnessed the night before. She spoke gently to Mr. Patterson, asking him to follow simple commands, while observing his responses with intense concentration. "Has anyone done a fast exam?" Alex asked Margaret. Dr. Morrison did a quick assessment when he came in, Margaret replied. Said to wait for neurology for anything detailed. Alex's jaw tightened almost imperceptibly. Sarah recognized the expression. It was the look of someone who disagreed with a decision, but was constrained by hierarchy. How long ago did the symptoms start? Margaret checked her notes. About 90 minutes, according to his wife. Sarah saw Alex's eyes widen slightly. In stroke care, time was critical. The therapeutic window for certain treatments was rapidly closing, and waiting for the neurologist could mean the difference between full recovery and permanent disability. Dr. Chen, Alex said carefully, has anyone considered thrombolytic therapy? We're still within the treatment window if this is an ischemic stroke. Sarah was impressed by Alex's knowledge of stroke protocols. Thrombolytic therapy, clot-busting drugs, was indeed indicated for certain types of strokes, but the decision required sophisticated imaging and careful risk assessment. It wasn't the kind of treatment most medics would even know about, let alone recommend. The neurologist will make that call when he's available, Sarah replied, watching Alex's reaction. Alex nodded, but Sarah could see her frustration. She moved around the patient's bed, conducting her own informal neurological assessment with the kind of systematic thoroughness that suggested extensive training. Her examination technique was flawless. She tested coordination, reflexes, and cognitive function with the precision of a specialist. Dr. Morrison entered the bay, looking harried. "How's our stroke patient?" "Stable, but no improvement," Margaret reported. "Still waiting for neurology." Morrison glanced at his watch. "Dr. Brennan should be out of surgery soon. Keep monitoring and let me know if there are any changes." After Morrison left, Alex approached Sarah quietly. "Dr. Chen, I'm concerned about the time factor. Mr. Patterson is showing signs of a large vessel occlusion. The longer we wait—" "What makes you think it's a large vessel occlusion?" Sarah asked, genuinely curious about Alex's assessment. "The pattern of deficits, the severity of the presentation, the fact that he's not improving with time. These are classic indicators for a clot in a major cerebral artery." Sarah stared at Alex. Large vessel occlusion was a sophisticated diagnosis that required detailed neurological training to recognize. It was also one of the most time-sensitive emergencies in medicine. Patients could lose millions of brain cells with every minute of delay. "Alex, where exactly did you learn stroke neurology?" Before Alex could answer, the monitor alarms began sounding. Mr. Patterson was experiencing a significant deterioration, his blood pressure dropping, and his consciousness level declining rapidly. Alex moved instantly, checking the patient's airway and pulse, while Sarah called for Morrison. Within seconds, the bay filled with medical personnel responding to the emergency. "He's going into a coma," Morrison announced after a quick assessment. "Get me an emergency CT scan and call neurology again." Alex positioned herself near the patient's head, monitoring his breathing and neurological responses. Sarah watched as she performed subtle adjustments to his positioning and oxygen delivery. Small actions that demonstrated intimate familiarity with neurological emergencies. The CT scan results came back 20 minutes later, confirming Alex's assessment. Mr. Patterson had a large clot blocking a major cerebral artery, exactly as she had predicted. By then, however, valuable time had been lost. Dr. Brennan, the neurologist, finally arrived and reviewed the scans. "This is definitely a candidate for thrombectomy, but we're pushing the time limits. If we'd caught this an hour ago." Sarah looked at Alex, who was standing quietly at the back of the room. Her expression was carefully neutral, but Sarah could see the frustration in her eyes. She had recognized the urgency of the situation long before anyone else, but her position as a contract medic had prevented her from advocating more forcefully for immediate action. As Mr. Patterson was rushed to the interventional suite for emergency surgery, Sarah cornered Alex in the hallway. "We need to talk." They found a quiet corner in the break room, away from the evening shift bustle. Sarah sat across from Alex, studying her carefully. "That was remarkable assessment work there. You diagnosed a large vessel occlusion faster than most residents could, and you were absolutely right about the time sensitivity." Alex remained silent, her expression guarded. "The question is," Sarah continued, "how does a contract medic develop that level of expertise in stroke neurology? That's not basic EMT training or even paramedic school. That's specialist-level knowledge." Alex met Sarah's gaze steadily. "I've seen a lot of different cases in my career." "Where? What career? Because according to your file, you barely existed professionally before 2 years ago." For a moment, Sarah thought Alex might open up. Her professional mask wavered, and something vulnerable flickered across her face. But then the walls went back up. "Dr. Chen, I appreciate your concern, but my background isn't relevant to my current position. I'm here to do whatever job you assign me, nothing more." Sarah leaned forward. "Alex, I don't know what your story is, but it's clear you have skills that go far beyond what we're utilizing. If there's something you're not telling us about your qualifications." "There isn't," Alex said firmly, standing to end the conversation. "Is there anything else you need from me tonight?" Frustrated but not willing to push further, Sarah let her go. But as Alex returned to her duties, Sarah made a decision. She was going to find out who Alex Thompson really was, even if it meant going outside official channels. The rest of the shift passed uneventfully, with Alex handling routine cases with the same quiet competence she'd shown the night before. But Sarah continued to observe, noting details that painted a picture of someone with far more experience than she claimed. During a quiet moment, Sarah called her friend, Detective Mike Rodriguez, with the local police department. Mike had connections throughout the law enforcement and emergency services community. If Alex had worked in any official capacity, he might be able to trace her background. "Mike, I need a favor. Can you run a background check on someone for me, completely unofficial?" "Sarah, you know I can't use department resources for personal requests." "This isn't personal. I have a staff member whose qualifications don't match her capabilities. I'm concerned about patient safety." Mike sighed. "What's the name?" "Alex Thompson. She's working as a contract medic, but her medical knowledge suggests much more extensive training. I'll see what I can find through informal channels. No promises, though." After ending the call, Sarah returned to the emergency department to find Alex dealing with a new arrival, a construction worker who'd fallen from scaffolding. The patient was conscious, but showing signs of possible spinal injury. Alex was conducting a careful neurological assessment, testing sensation and motor function with systematic precision. Her technique was textbook perfect, and she identified several concerning findings that warranted immediate imaging. "Dr. Chen," Alex called out, "I'm seeing decreased sensation in the lower extremities and some weakness in dorsiflexion. We should consider cervical and thoracic imaging." Once again, Alex's assessment proved accurate. The CT scans revealed compression fractures in the thoracic spine that could have been missed with a less thorough examination. Her early identification potentially prevented permanent paralysis. Dr. Morrison, who had observed the case, pulled Sarah aside afterward. "I don't know where you found Thompson, but she's got better diagnostic skills than half our residents. Maybe we should consider offering her a permanent position." Sarah nodded, but her mind was racing. Alex's pattern of exceptional performance was becoming impossible to ignore. She wasn't just competent, she was demonstrating the kind of clinical judgment typically seen only in experienced physicians or highly specialized medical personnel. As the shift ended and Alex prepared to leave, Sarah made one more attempt to break through her professional reserve. "Alex, can I ask you something? Off the record?" Alex paused, her hand on her personal bag. "What is it?" "Have you ever considered that you might be working below your capabilities? Your diagnostic skills, your knowledge of complex medical conditions. You could be doing much more than basic medic work." Alex was quiet for a long moment, and Sarah thought she might finally get a real answer. When Alex spoke, her voice carried a weight that suggested deep personal pain. "Sometimes, Dr. Chen, doing more isn't an option. Sometimes you have to be grateful for the chance to help people in whatever capacity you can." With that cryptic statement, Alex walked toward the exit, leaving Sarah with more questions than ever. But she was determined to uncover the truth. Tomorrow night, she would be ready with more pointed questions and hopefully some answers from Mike's investigation. As Sarah watched Alex disappear into the parking garage, she couldn't shake the feeling that St. Helena Medical Center was harboring someone whose true story would prove far more complex and significant than anyone imagined. The quiet contract medic who deflected questions and downplayed her abilities was clearly someone who had fallen from greater heights. Someone whose past held secrets that might explain her extraordinary present capabilities. The investigation was just beginning, and Sarah sensed that the answers, when they came, would change everything about how they understood Alex Thompson. Dr. Sarah Chen's phone buzzed at 2:47 p.m., just as she was finishing lunch in the hospital cafeteria. Detective Mike Rodriguez's name appeared on the screen, and Sarah's pulse quickened. She'd been waiting 3 days for his call about Alex Thompson's background check. "Mike, please tell me you found something." "Sarah, we need to meet in person. This isn't something I can discuss over the phone." His voice carried an unusual tension that made Sarah's stomach tighten. "That's serious?" "Meet me at Brewster's Coffee on 5th Street in an hour. Come alone, and don't mention this conversation to anyone at the hospital." The line went dead, leaving Sarah staring at her phone with growing unease. Mike's tone suggested he'd discovered something significant and potentially troubling about their mysterious contract medic. An hour later, Sarah found Mike sitting in a corner booth at the nearly empty coffee shop, his laptop closed and his expression grim. He waited until she sat down before speaking. "Sarah, before I tell you what I found, I need to know, has this Alex Thompson done anything that would endanger patients or compromise hospital security?" "No, just the opposite. She's been exceptional with patient care. Why?" Mike opened his laptop and turned the screen toward her. "Because Alex Thompson officially died 3 years ago." Sarah stared at the screen, displaying a newspaper obituary. The photograph showed a woman who was unmistakably their contract medic, though the hair was longer and the face carried less of the guarded wariness Sarah had come to recognize. Dr. Alexandra Thompson, age 29, died in a helicopter crash while serving with Doctors Without Borders in Somalia. Memorial service held at Arlington National Cemetery, survived by no immediate family. Sarah's mind reeled. "That can't be right. She's been working at our hospital. I've spoken with her, seen her treat patients." "Keep reading," Mike said quietly. The obituary continued with details that made Sarah's breath catch. Dr. Alexandra Thompson had been a trauma surgeon specializing in emergency medicine and battlefield injuries. She'd served 2 tours with military medical units before transitioning to humanitarian work. Her decorations included the Bronze Star for treating wounded soldiers under enemy fire. "A trauma surgeon," Sarah whispered. "That explains everything. The diagnostic skills, the knowledge of complex procedures, the way she handles crisis situations." Mike turned the laptop to show another document. "Here's where it gets interesting. I reached out to a contact at the State Department. Officially, Dr. Thompson died in that helicopter crash. But there are rumors in certain circles about survivors who were never found, people who might have been extracted by other organizations for alternative purposes." "What kind of alternative purposes?" "The kind that requires medical professionals with combat experience to disappear from official records." Think about it, Sarah. Someone with her background would be incredibly valuable to intelligence agencies, private military contractors, or organizations that operate in gray areas where official medical personnel can't go. Sarah studied the photograph again, seeing past the obvious physical similarities to recognize subtle details. The woman in the obituary photo wore her authority openly. Confident posture, direct gaze, the bearing of someone accustomed to making life-and-death decisions. The Alex Thompson working at St. Helena kept that same authority carefully hidden beneath a facade of deference. So you think she's been working some kind of covert medical operations for the past 3 years? That's my best guess. But something must have gone wrong or changed, because now she's surfaced in civilian medicine using her real identity. People don't usually come back from the dead unless they're running from something or towards something. Sarah's phone buzzed with a text message from the hospital. Emergency department needed all available staff. Multiple casualties from a factory explosion were incoming. She stood abruptly. "Mike, I have to get back." Mass casualty event. "Sarah, be careful. If I'm right about Thompson's background, she's someone who's been living in dangerous situations for years. Whatever brought her to your hospital, it's probably not as simple as wanting a quiet civilian job." Sarah drove back to St. Helena with her mind racing. Alex Thompson wasn't just an overqualified medic. She was a presumed dead trauma surgeon with military and humanitarian experience who'd been operating in the shadows for 3 years. The question was why she'd chosen to resurface now, and what it meant for the hospital. She arrived to find the emergency department in full mobilization mode. 6 critically injured factory workers were en route, with burns, crush injuries, and suspected chemical exposure. The entire staff was being called in, including all available contract personnel. Alex had already arrived and was helping to prepare trauma bays. Sarah watched her with new eyes, seeing past the contract medic facade to recognize the movements of someone who'd commanded medical teams in war zones. Her positioning of equipment, her anticipation of supply needs, her systematic preparation for multiple casualties, it all spoke to extensive experience with mass casualty scenarios. Dr. Morrison appeared at Sarah's elbow. "Thank God Thompson's here tonight. With this many critical patients coming in, we'll need every skilled hand available." The first ambulance arrived, carrying a man with severe burns covering 40% of his body. Alex immediately stepped forward, her entire demeanor shifting as she took charge of the resuscitation with an authority that no one questioned. "I need 2 large-bore IVs, Ringer's lactate wide open, and a central line kit," she directed. Her voice carrying the command presence Sarah now understood came from battlefield medicine. "Someone get me blood gas supplies and call the burn center for immediate transfer protocols." Dr. Morrison started to object. "Thompson, you're not authorized to." "Dr. Morrison," Alex interrupted, her tone brooked no argument, "this patient has inhalation injuries and is going into shock. We don't have time for protocol discussions." Something in her voice made Morrison step back. Sarah watched, fascinated, as Alex transformed from deferential contract medic into commanding trauma surgeon. Her hands moved with surgical precision, establishing access and beginning fluid resuscitation, while simultaneously assessing airway complications. "Sarah," Alex called out, using Dr. Chen's first name for the first time, "I need you to intubate. This patient's airway is compromised from smoke inhalation." Sarah moved to comply, but found herself following Alex's lead, rather than directing the case. It was a complete reversal of their usual dynamic, and it felt entirely natural. Alex was clearly the most qualified person in the room to manage severe burn trauma. The second ambulance brought a woman with crush injuries to her lower extremities. While Dr. Walsh worked on stabilizing her, Alex divided her attention between both patients, offering suggestions and adjustments that demonstrated intimate familiarity with complex trauma management. "The compartment pressure in her left leg is elevated," Alex observed quietly to Dr. Walsh. "She's going to need an emergency fasciotomy if you want to save the limb." Walsh looked up from his examination. "How can you tell from across the room?" "The color changes, the swelling pattern, the way she's positioning her leg to minimize pain, it's classic compartment syndrome." Her assessment proved correct. Within minutes, the patient's condition deteriorated exactly as Alex had predicted, requiring immediate surgical intervention to prevent permanent damage. By the time the third and fourth ambulances arrived, Alex had effectively taken command of the entire mass casualty response. Her experience showed in every decision, triaging patients, allocating resources, coordinating care between multiple teams. She moved through the chaos with the calm efficiency of someone who'd managed similar situations in much more challenging environments. Dr. Elizabeth Harper, the emergency department director, had arrived to oversee the response. She pulled Sarah aside during a brief lull. "Dr. Chen, where did we find Thompson? She's running this mass casualty like a seasoned trauma attending. I've never seen a contract medic with that level of leadership capability." Sarah chose her words carefully. "She seems to have extensive experience with complex trauma cases." Extensive doesn't begin to cover it. She's thinking 3 steps ahead of everyone else, anticipating complications before they develop. That's the kind of clinical judgment you only see in physicians who spent years managing critical cases. As if summoned by their conversation, Alex appeared with updates on all 6 patients. Her report was comprehensive and precise, delivered with the systematic thoroughness of someone accustomed to briefing senior medical staff. "Patient 1 is stable for transfer to the burn center. Patient 2 is prepped for emergent fasciotomy. Patient 3 has been ruled out for internal bleeding but needs orthopedic consultation. Patient 4's chemical exposure is responding to decontamination protocols. Patients 5 and 6 are stable with minor injuries." Dr. Harper stared at Alex. "That's a remarkably thorough assessment for... What's your background again?" Alex's expression shifted back toward the guarded neutrality Sarah had become familiar with. "I've worked in various emergency settings, Dr. Harper." "Various settings," Harper repeated slowly. "Well, whatever settings those were, they clearly prepared you well for tonight." As the immediate crisis subsided and patients were transferred to appropriate units, Sarah found herself alone with Alex in the break room. The transformation she'd witnessed was impossible to ignore. Alex had briefly dropped her carefully maintained facade to reveal someone with extraordinary medical leadership capabilities. "Alex," Sarah said quietly, "we need to talk about what happened tonight." Alex was removing her gloves, her movements deliberate and controlled. What about it? You took command of a mass casualty event like someone who's done it dozens of times before. That wasn't the behavior of a contract medic. That was the behavior of a trauma surgeon. Alex met her gaze directly. I did what needed to be done to help the patients. Yes, you did. And you did it with the skill level of someone with years of advanced training and experience. Sarah paused, choosing her next words carefully. Alex, I know who you are. The silence stretched between them, charged with tension. Alex's expression remained neutral, but Sarah could see the calculation behind her eyes. Assessing options, considering responses, preparing for whatever came next. I don't know what you think you know, Dr. Chen. I know that Dr. Alexandra Thompson died 3 years ago in Somalia. I know she was a trauma surgeon with military experience. And I know that someone with her exact face and capabilities is working in my emergency department under circumstances that suggest she didn't actually die in that helicopter crash. Alex stood slowly, her posture shifting into something more defensive. Even if that were true, what would you plan to do with such information? I'd plan to ask why someone with your qualifications is hiding behind a contract medic position instead of using her skills to their full potential. Maybe, Alex said quietly, because sometimes using your skills to their full potential leads to consequences you can't live with. The pain in her voice was unmistakable, and Sarah realized she'd touched on something profound. Whatever had happened during Alex's presumed death and subsequent 3-year disappearance, it had left emotional scars that ran deep. Alex, whatever happened before, you're here now. Tonight you saved lives that might have been lost without your expertise. Doesn't that matter more than whatever you're running from? Alex gathered her belongings, her movements sharp with suppressed emotion. Dr. Chen, I appreciate your concern, but my situation is more complicated than you can understand. Please don't pursue this further. She walked toward the door, then paused without turning back. The patients tonight received the best care possible, that's what matters. Everything else is just details. As Alex disappeared into the hallway, Sarah remained in the break room, processing what she'd learned. The woman they'd known as a contract medic was actually a highly skilled trauma surgeon who'd faked her death and spent 3 years in some kind of covert medical work. Tonight's crisis had forced her to reveal capabilities she'd been carefully hiding, but it had also shown the depth of whatever trauma had driven her underground. Sarah's phone buzzed with another text from Mike Rodriguez. Found more information about Thompson's last known activities. We definitely need to talk again. This goes deeper than we thought. Looking out at the emergency department where Alex had just demonstrated world-class trauma management skills, Sarah realized that tonight's mass casualty event had been more than a medical emergency. It had been a revelation that would change everything about how the hospital viewed their mysterious contract medic. The question now was whether Alex would continue trying to hide her true identity, or whether the satisfaction of practicing medicine at her actual skill level would overcome whatever fears had kept her in the shadows for 3 years. Either way, Sarah was certain of one thing. St. Helena Medical Center had unknowingly hired one of the most qualified trauma surgeons in the country. The challenge would be convincing Alex that she deserved to practice medicine openly, rather than hiding behind a facade that diminished her extraordinary capabilities. 3 days after the factory explosion incident, Alex Thompson had not returned to St. Helena Medical Center. Her assigned shifts went unfilled, and the staffing agency claimed they had no current contact information for her. Dr. Sarah Chen found herself checking the emergency department entrance every few minutes, wondering if Alex would simply walk through the doors as quietly as she had arrived. The hospital's administrative offices were buzzing with activity that Tuesday morning, when Sarah received an unexpected call to Dr. Elizabeth Harper's office. She found the emergency department director meeting with 2 individuals Sarah didn't recognize, a stern-faced woman in a business suit and a man whose bearing screamed federal agent. Dr. Chen, please sit down, Dr. Harper said, her expression unusually tense. These are Agent Janet Walsh from the Department of Homeland Security and Agent David Kim from the FBI. They're here about Alex Thompson. Sarah's stomach dropped. What about her? Agent Walsh opened a tablet and turned it towards Sarah. Dr. Chen, we need to know everything about your interactions with the woman calling herself Alex Thompson. Her real name is Dr. Alexandra Maria Thompson, and she's been missing from federal custody for 6 months. The tablet displayed Alex's photograph alongside official government identification. But this wasn't the presumed dead trauma surgeon from the obituary. This was someone listed as a federal witness in protective custody who had disappeared from a safe house in Denver. Federal custody, Sarah managed? The obituary said she died in Somalia 3 years ago. Agent Kim leaned forward. Dr. Thompson did survive the helicopter crash in Somalia, but she was captured by a terrorist organization called the Black Serpent. For 18 months, they forced her to provide medical care to their wounded fighters while using her as leverage in negotiations with the U.S. government. Sarah felt the room spinning. She was a prisoner? Eventually, she was rescued by a joint military operation, Agent Walsh continued. But during her captivity, she was exposed to information about international arms dealing and terrorist financing networks. The intelligence she provided led to several major operations, but it also made her a target for revenge. Agent Kim pulled up another document. 6 months ago, Dr. Thompson was living under federal protection while testifying in a series of classified trials. Then someone leaked the location of her safe house. When our agents arrived to check on her, they found 2 dead bodyguards and no sign of Dr. Thompson. Dead bodyguards? Sarah's voice was barely a whisper. Professional assassination, Agent Walsh confirmed grimly. We assumed Dr. Thompson had been captured or killed by the same people she'd been testifying against. Until 3 days ago, when facial recognition software flagged her appearance at this hospital during your mass casualty event. Sarah tried to process the information. Alex wasn't just a trauma surgeon hiding from her past. She was a federal witness on the run from assassins, someone whose testimony could bring down international criminal networks. Dr. Chen, Agent Kim said, we need to know if Dr. Thompson said anything about being followed, about feeling unsafe, or about planning to leave the area. She barely said anything personal at all. Sarah replied. She kept to herself, deflected questions about her background, and seemed determined to maintain her cover as a contract medic. Agent Walsh exchanged glances with her partner. That's consistent with someone trying to disappear completely, but her performance during the factory incident was too visible. Too many people saw her demonstrate capabilities that don't match her supposed background. Dr. Harper spoke up. Agents, I'm confused about something. If Dr. Thompson is such a valuable witness, why isn't she in protective custody? Why is she working as a medic in a civilian hospital? Because, Agent Kim said grimly, someone inside our organization is feeding information to the people who want her dead. 3 safe houses have been compromised in the past year. Dr. Thompson apparently decided that disappearing on her own was safer than trusting federal protection. The meeting was interrupted by Dr. Harper's pager buzzing urgently. She checked the message and her face went pale. There's been an incident at the children's hospital across town, mass shooting. They're requesting immediate assistance from all area emergency departments. Sarah's blood chilled. The children's hospital was where Alex had been seen yesterday, according to a nurse who'd spotted her in their cafeteria. How many casualties? Initial reports say 12 wounded, including children and staff. The perpetrator is still active and first responders can't reach all the victims. Agent Walsh stood abruptly. Dr. Chen, if Dr. Thompson is anywhere near that situation, she's in extreme danger. The people hunting her won't hesitate to exploit a crisis to eliminate her. As they rushed toward the hospital parking garage, Sarah's phone rang. The number was blocked, but she answered anyway. Dr. Chen? The voice was unmistakably Alex's, though it was strained and urgent. I need you to listen carefully. I'm at Children's Memorial Hospital, and I need you to bring specific supplies. Alex, where are you? The FBI is looking for you, and… Sarah, listen to me. There are 6 children trapped in the pediatric surgery ward with a gunman. The elevators are disabled, and emergency responders can't reach them. These kids will die if someone doesn't get to them in the next hour. Sarah's training overrode her shock. What supplies do you need? Portable surgical kit, blood products, pediatric airway management supplies, and as much IV fluid as you can carry. The second-floor bridge connects our buildings. You can get here without going through the main entrances. Agent Walsh grabbed Sarah's phone. Dr. Thompson, this is Agent Walsh, FBI. You need to evacuate immediately. Your location has been compromised. Agent Walsh, there are children bleeding out up here. I'm not leaving them to die while you sort out your jurisdictional issues. Dr. Thompson, The people hunting you have been tracking emergency response channels. They know you're there." Alex's voice carried steel resolve. "Then they can wait in line behind the 6-year-old with a severed artery who needs immediate surgery." The line went dead. Agent Kim was already coordinating with tactical teams, but Sarah could see the grim calculations in their expressions. Getting to Alex would require navigating an active shooter situation, while potentially walking into a trap set by international assassins. Sarah made a decision that surprised everyone, including herself. "I'm going to her." "Dr. Chen, absolutely not," Dr. Harper protested. "This is a law enforcement situation. Those children need immediate medical care, and Alex can't handle 6 critical patients alone. I'm going." Agent Walsh stepped in front of her. "Dr. Chen, if you go in there, you become a target too. These aren't ordinary criminals. They're professional killers who've been hunting Dr. Thompson for months. Then Alex needs backup even more than I thought." 20 minutes later, Sarah found herself moving through the hospital bridge connecting St. Helena to Children's Memorial, carrying 2 heavy bags of medical supplies and wearing a bulletproof vest provided by the FBI tactical team. The bridge was eerily quiet, with only emergency lighting illuminating the long corridor. Her radio crackled with updates from the tactical team. "Bridge team, be advised we have 3 suspicious vehicles circling the hospital perimeter. Unknown occupants possibly hostile." Sarah's hands trembled as she reached the children's hospital entrance. Through the glass doors, she could see overturned furniture and signs of chaos from the evacuation. Emergency lighting cast eerie shadows through the normally cheerful pediatric decorations. She made her way to the stairs, climbing toward the surgery ward where Alex was trapped with the wounded children. Each floor seemed to amplify the weight of the medical supplies she carried and the magnitude of what she was walking into. On the 3rd floor, she found Alex in a supply room that had been converted into a makeshift operating theater. The sight that greeted her was both horrifying and inspiring. Alex had somehow managed to stabilize 6 wounded children using minimal equipment, creating IV access, controlling bleeding, and maintaining airways with whatever supplies she could scavenge. "Sarah, thank God," Alex said without looking up from the small boy she was treating. "I need you to take over airway management for the girl in the corner while I finish this arterial repair." Sarah moved automatically, her medical training overriding the surreal situation. The injured girl, who couldn't have been more than 8 years old, was breathing, but showing signs of respiratory distress. Sarah began setting up the pediatric airway equipment Alex had requested. "Alex, how long have you been working on them?" 4 hours. The surgical repairs are holding, but I can't get them stable enough for transport while the shooter is still active in the building." Sarah looked around at the improvised medical setup. Alex had performed what amounted to field surgery using basic supplies, somehow keeping 6 critically wounded children alive without proper equipment or support staff. It was a demonstration of medical skill that bordered on miraculous. "The FBI is here," Sarah said while adjusting the girl's oxygen delivery. "They know who you really are, about Somalia, about witness protection, about the people hunting you." Alex's hands never stopped moving as she continued working on the arterial repair. "I figured they'd catch up eventually. How long before tactical teams can reach us?" "They're waiting for the all-clear from the SWAT team dealing with the shooter." Alex nodded grimly. "Sarah, I need you to know something. The people hunting me won't hesitate to hurt anyone who gets in their way. By coming here, you've put yourself in danger. These children were already in danger. Whatever else is happening, that matters more." For the first time since Sarah had arrived, Alex looked up from her patient. Her eyes showed a mixture of gratitude and deep concern. "Sarah, if something happens to me, you need to know that these kids can be moved in about an hour. The repairs will hold for transport if you maintain their current medications and fluid rates. Nothing's going to happen to you." Alex returned to her work, but Sarah could see the tension in her shoulders. "You don't understand what these people are capable of. They've been hunting me for months, and they're very good at what they do." The radio on Sarah's vest crackled with an urgent transmission. "All units, we have confirmed visuals of 3 armed individuals entering the hospital through the emergency department. They appear to be moving toward the upper floors." Sarah felt her blood turn to ice. The assassins hunting Alex had arrived, and they were trapped on the surgery ward with 6 critically wounded children who couldn't be moved. Alex heard the transmission, and her expression hardened into something Sarah had never seen before. Gone was the quiet, deferential contract medic. Gone even was the skilled trauma surgeon who'd emerged during the factory explosion. What remained was someone who'd survived 18 months of captivity and 6 months of running from professional killers. "Sarah," Alex said, her voice carrying deadly calm, "in about 10 minutes this is going to become a very different kind of emergency. Are you prepared for that?" Looking at the wounded children they'd spent hours stabilizing, Sarah realized that whatever was coming next would test everything they'd accomplished and everything they were willing to sacrifice to protect the innocent lives in their care. The crisis was about to become something far more dangerous than either of them had ever imagined. The next 57 minutes tested every skill Alex Thompson had acquired through 18 months of captivity, 6 months of survival, and 15 years of medical training. Wave after wave of coordinated attacks came at their improvised defensive position, each one more sophisticated than the last. Alex moved through the chaos with lethal efficiency, neutralizing threats while simultaneously managing the complex medical needs of 6 critically wounded children. Sarah watched in amazement as Alex performed what amounted to combat surgery, maintaining IVs and adjusting medications between defensive actions. When 4-year-old Emma's blood pressure dropped dangerously during the 3rd assault, Alex calmly administered vasopressors while using a defibrillator as an improvised shield against incoming fire. "Sarah, I need you to take over cardiac monitoring for the boy in bed 3, Alex called out during a brief lull, her voice steady despite having just disabled 2 more attackers. "His rhythm is becoming irregular." Dr. Sarah Chen moved to comply, her hands trembling slightly as she adjusted the monitor leads. Around them, the supply room had been transformed into something resembling a battlefield medical station, with unconscious attackers zip-tied in the corner and medical equipment arranged for both patient care and tactical advantage. "Alex, how are you doing this? How are you thinking about medication dosages while fighting for our lives?" Alex was checking the arterial repair on 8-year-old Marcus while keeping one eye on the corridor entrance. "In Somalia, I learned to compartmentalize. Medical decisions stay medical, tactical decisions stay tactical. You can't let them interfere with each other or people die." The satellite phone buzzed with an update. Alex checked it quickly while maintaining her monitoring of the children's vital signs. "Tactical support is 10 minutes out. We just need to hold a little longer." As if responding to her words, the remaining attackers launched their most coordinated assault yet. This time, they came from multiple directions simultaneously, through the main door, through a maintenance access they'd forced open, and through the ceiling tiles above. Alex moved with fluid precision, using her knowledge of the building's layout to predict their approach vectors. She'd positioned medical equipment to channel their movements into predetermined kill zones, then used her understanding of human anatomy to disable rather than kill when possible. But Sarah could see the toll the extended engagement was taking. Alex had been providing intensive medical care and tactical defense for nearly 6 hours, and exhaustion was beginning to show despite her extraordinary training and determination. "Alex, you're bleeding," Sarah observed, noticing a cut on Alex's arm from a piece of shattered equipment. "Surface wound. The children need me to be functional more than they need me pristine." During the 4th wave of attacks, Alex did something that demonstrated the full scope of her unique capabilities. While simultaneously defending their position and maintaining critical patient care, she began talking one of the younger attackers through surrendering. "You're bleeding from a femoral artery puncture," she called out to a wounded attacker who'd been hit by ricocheting medical equipment. "You have about 8 minutes before you lose consciousness from blood loss. I can save your life, but you need to put down your weapon." The wounded man looked confused, caught between his mission objectives and the realization that his target was offering to provide life-saving medical care. "Your employers sent you here to die," Alex continued, never stopping her work on little Emma's IV. "I'm offering you a chance to live, but you need to decide quickly: medical intervention or bleeding out on a hospital floor." Sarah watched in fascination as Alex's combination of medical authority and tactical psychology began working. The wounded attacker was clearly struggling with the cognitive dissonance of being offered medical care by his intended target. "Dr. Thompson," the man called out in heavily accented English, If I surrender, will you really treat my wounds? I'm a doctor, Alex replied simply. My oath doesn't have exceptions for people trying to kill me. The man slowly placed his weapon on the floor and applied pressure to his wound. Alex immediately moved to stabilize him, working quickly to control his bleeding while maintaining her defensive posture. Sarah, can you take over his care? Standard trauma protocol for arterial bleeding. As Sarah moved to help the wounded attacker, she realized she was witnessing something extraordinary. Alex had successfully converted an enemy into a patient without compromising their defensive position or the care of the children. Alex, why did you save him? Because proving that medical ethics survive in impossible situations is how we stay human, Alex replied, adjusting the sedation for their youngest patient. And because a grateful patient is better than a motivated enemy. The psychological effect on the remaining attackers was immediate. Their coordination faltered as they processed the fact that their target had just provided medical care to their wounded colleague. The tactical situation shifted from a coordinated assault to confused hesitation. Alex used the opportunity to address the remaining attackers directly. Your mission was to eliminate a witness, but that witness has just spent 6 hours proving that she values life over death, medical care over revenge. Is that really someone your employers need to fear? The response came in the form of a bullhorn from outside the building. Dr. Thompson, this is Agent Walsh with the FBI. Federal tactical teams are in position. Hostile forces, you are surrounded. Surrender immediately. Alex moved to the window and assessed the situation outside. FBI tactical vehicles had surrounded the building, and she could see federal agents coordinating with local law enforcement to establish a perimeter. Tactical teams are moving up the stairwells, she reported to Sarah. This should be over in the next few minutes. But the remaining attackers weren't ready to surrender. Instead of retreating, they made a desperate final assault on the supply room, using their last ammunition and equipment in an all-or-nothing attempt to complete their mission. Alex met this final assault with everything she had learned and become over the past 3 years. Moving with the fluid precision of someone who had been forged by impossible circumstances, she neutralized the remaining threats while simultaneously coordinating the children's medical care and providing tactical information to the approaching federal agents. When FBI tactical teams finally breached the supply room, they found a scene that would become legendary in law enforcement circles. Alex Thompson stood calmly checking the pulse of 4-year-old Emma while surrounded by 11 unconscious or wounded attackers, all of whom were receiving basic medical care despite having tried to kill her. Agent Walsh surveyed the scene with obvious amazement. Dr. Thompson, are you injured? Minor cuts and exhaustion. The children need immediate transport to the pediatric ICU. I've maintained their stabilization for 6 hours, but they need surgical facilities I can't provide here. Agent Kim began coordinating the medical evacuation while Walsh approached Alex. Dr. Thompson, what you've accomplished here is unprecedented. You've successfully defended 6 children against 11 professional assassins, while providing complex medical care. Alex was already preparing her patients for transport, ensuring that all their medical information was properly documented for the receiving physicians. Agent Walsh, these children need pediatric trauma specialists. Everything else can wait. Over the next hour, as the children were carefully transported to the main hospital and Alex's patients were turned over to the pediatric surgery team, the full scope of what had occurred began to emerge. Alex had performed multiple complex surgical procedures under fire, maintained 6 critically ill children in stable condition for over 6 hours, and single-handedly defeated an 11-person assassination team. Dr. Elizabeth Harper arrived as the last child was being wheeled into surgery. She found Alex in the hospital cafeteria, finally allowing herself to show the exhaustion of her 6-hour ordeal. Dr. Thompson, Harper said, sitting across from her, I've just reviewed the medical records of what you accomplished tonight. In my 30 years of emergency medicine, I've never seen anything like it. Alex looked up from the coffee she'd been staring at without drinking. The children, are they going to be okay? Thanks to your care, all 6 are expected to make full recoveries. The pediatric surgeons said your field work was flawless. They couldn't have done better with full surgical facilities. Agent Walsh joined them, carrying a tablet with official documents. Dr. Thompson, we need to discuss your future status. The assassination team was working for the same networks you've been testifying against. Your actions tonight have effectively ended their operations. Alex raised an eyebrow. Meaning? Meaning that your testimony is no longer needed. The evidence collected tonight, combined with the arrests of these operatives, has provided enough evidence to shut down their entire organization. You're no longer a target. Sarah Chen, who had been waiting in the background, approached the table. Alex, what does that mean for you? Alex was quiet for a long moment, processing the implications. For the first time in 3 years, she was free to exist openly, to practice medicine without hiding, to build a life instead of simply surviving. Dr. Thompson, Harper said carefully, I'd like to offer you a position as our Director of Trauma Services. Your qualifications are obviously exceptional, and after tonight, I think our board would approve anything you requested. Alex looked around the cafeteria, at Sarah, who had risked everything to help save children's lives, at Agent Walsh, who represented the end of her years of running, at Dr. Harper, who was offering her a chance to return to the medicine she loved. Dr. Harper, I appreciate the offer, but I need some time to remember who I am when I'm not running or fighting. Sarah leaned forward. Alex, you've spent tonight proving exactly who you are. You're someone who puts patients before personal safety, who maintains medical ethics under impossible pressure, and who would rather save lives than take them. Alex smiled, the first genuine smile Sarah had seen from her in all their time working together. Sarah, are you offering to help me figure out how to be a normal doctor again? I'm offering to help you figure out how to be the extraordinary doctor you've always been, just without people trying to kill you. 6 months later, Dr. Alexandra Thompson stood in Trauma Bay 1 at St. Helena Medical Center, leading a team of residents through a complex multiple trauma case. The patient, a teenager injured in a motorcycle accident, was stable and responding well to treatment. Dr. Martinez, she said to one of the residents, what's your assessment of the patient's neurological status? Alert and oriented, normal reflexes, no signs of head injury. Good, Dr. Patel, how are we doing with orthopedic injuries? As her team continued their work, Alex reflected on the journey that had brought her back to practicing medicine openly. The children from that night had all made full recoveries, and several of their families had become close friends. The attackers who had survived were serving long prison sentences, and the international networks they'd represented had been dismantled. Sarah appeared at her elbow with a tablet showing the patient's latest lab results. Everything looks good. He should be ready for transfer to orthopedics within the hour. Excellent work, everyone, Alex announced to the team. Dr. Chen and I will handle the transfer coordination. As the residents dispersed to other cases, Sarah and Alex found themselves alone in the trauma bay. The easy partnership they developed during that terrible night had evolved into something deeper, a professional relationship built on absolute trust and shared experience. Any regrets? Sarah asked quietly. Alex looked around the emergency department where she'd first arrived as a contract medic trying to disappear. Now she was the Director of Trauma Services, overseeing a department that had become one of the most respected emergency medicine programs in the region. About leaving the shadows, about coming back to medicine officially, about trusting you with the truth, Alex shook her head. None at all. Even about that night, about everything you had to do? Alex was quiet for a moment, remembering the weight of those 6 hours when everything had balanced on her ability to be both doctor and defender simultaneously. Sarah, that night I learned something important. It doesn't matter whether people call you just a medic or doctor or trauma surgeon or any other title. What matters is that when people need you most, you're capable of being whoever they need you to be. She looked out at the emergency department where a new generation of medical professionals was learning to save lives, protected by the knowledge that their director had proven herself capable of holding any line that needed to be held. Besides, Alex added with a smile, someone has to train the next generation of doctors who might someday need to provide medical care under impossible conditions. Who better to teach them than someone who's actually done it? As they walked back toward the nurse's station, Alex Thompson, former prisoner, former witness, former contract medic, and now Director of Trauma Services, knew she had finally found her way home. She was exactly who she had always been meant to be, a doctor who would never stop fighting to save lives, no matter what the circumstances required. The ghost pilot had found her hangar, the missing surgeon had found her operating room, and Alex Thompson had finally found her way back to being the person she'd always been, beneath every identity crisis and survival situation, someone who believed that healing was worth any sacrifice, and that protecting the innocent was the highest calling anyone could answer. The children were safe, the hospital was protected, and Dr. Alexandra Thompson was exactly where she belonged. Up next, you've got two more standout stories right on your screen. If this one hits the mark, you won't want to pass these up. Just click and check them out. And don't forget to subscribe and turn on the notification bell so you don't miss any upload from us.